I'm James Lewis. I'm a consultant orthopaedic surgeon at Goring Hall Hospital here in Worthing. Considering a knee replacement can be quite daunting. They have a reputation for having a long and painful recovery. Traditionally, a surgeon would use a hammer to strike the implant into place. The bone in your hip for a hip replacement can tolerate this comfortably, but the specialised bone around the knee has a spongy honeycomb structure which is unable to tolerate this force. After doing an MSc in the forces across this specialised honeycomb bone, I've developed a hammer-free method. Using some simple but brilliant innovations during surgery, I've developed a technique that means I can place the knee implant under finger pressure without using a hammer. Using some simple but brilliant innovations during surgery, I've developed a technique that means I can place the knee implants under direct finger pressure without using a hammer, avoiding the damage to your bones during surgery and vastly improving your recovery. The hammer-free method offers a much gentler method of fitting the components. Our data shows that patients either have no pain or less pain than immediately before the operation, even though they've just had a knee replacement. They also have less swelling, less scarring, and easier range of motion. I can only apologise it took me so long to solve it. If you'd like to come and see me for a consultation, you can either book in online or contact Goring Hall Hospital directly.